Cuban society and the Cuban medical system address health differently than in the U.S., not only addressing disease, but also looking at a lot of the societal factors that lead to people becoming sick, like poverty and those types of things. And in Che Guevara's, I don't know if it's a speech or a paper that he wrote, but it's called On Revolutionary Medicine. He said that, he talks about fighting disease by, quote, creating a robust body. And he says the creation of a robust body with the work of the whole collectivity upon the entire social collectivity. Someday, therefore, medicine will have to convert itself into a science that serves to prevent disease and orients the public toward carrying out medical duties. So I think David was going to answer this briefly, and then if anybody else on the delegation wanted to answer, if you could just comment on your perspective on how health at like a societal level and at a healthcare system level it's addressed in Cuba.
Okay, so yeah, it is guaranteed in the revolution that it's a right for everybody, and that's really important to understand. And I do agree, we've talked about there are other first world countries, in fact, most first world countries have free healthcare. But Cuba, having the economy, they have a third world economy, they do take a slightly different approach than a lot of people. And a lot of that is just how incorporated it is through society. And I don't think that you can't not mention how they have the highest house ownership in the hemisphere, they have free health, education, period, and wrapped up into the healthcare. So I think all that makes a big effect. There's security in the country. You don't find homeless people in Cuba. It's a different perspective. But let's do a real quick breakdown of the Cuban medical system. It starts off with consultorios. Consultorios are little consults that the doctor lives on the top, and you could probably walk 5 minutes to 3 consultorios. You have one that's for you, but so every few blocks, right? There's a little consultorio. Then you have about, I want to say off the top of my head, I think 50 or 60 consultorios that we're paying to a polyclinic. In St. Louis, where I grew up, there's probably a polyclinic everywhere that there is an elementary school. And that's where your doctor in your neighborhood is going to send you to get your checkup for whether you have diabetes or you need some blood drawn, you need an x-ray, you need this. There's an urgent care center there 24 hours, it's orthopedic. So it has a certain amount of specialists, and it serves a role of urgent care center. Of course, it's free, and you can go there anytime. So your doctor and your consultorio really should kind of be 9 to 5, Monday through Friday. Realistically, it's your neighbors, so sometimes it goes more than that. But there is a polyclinic that can address anything that's urgent anytime that your doctor's not there. After that, for tertiary care, you have hospitals. And they have a lot of hospitals in Cuba. So the community we lived in Cerro had a hospital named after Salvador Allende, a famous president of Chile. And that hospital had general surgery, had orthopedics, we had ophthalmology, we have a lot of different things, a lot of different specialists. Most specialists, I would say that our emergency room wasn't quite what you would call like a level 1 trauma center here. There were 2 other hospitals in Havana that would get sent for more level 1 trauma, which basically means you have every specialist on call 24 hours a day. There's 2 hospitals I can think of in Cuba that people mostly go to, and I think there's a third one in Havana, in Havana, and I think there's a third one too that deals especially with like military and government and things like that. So they maybe have like 3 level 1 trauma centers for sure that I can think of in Havana. And then you have your quaternary institutes, and that's where the doctor works at, right? So we have the Cardiovascular Institute, we have oncology institutes, and there's an institute associated with every general hospital, which is kind of cool. So at our hospital, we had the angiology, vascular surgery, and things like that at our hospital. And in a Pete's hospital we worked at, we had rheumatology and endocrinology. So I had patients with juvenile rheumatoid, arthritis, and pretty rare diseases. And they would come to there. I saw Fanconi's anemia. I had a case of Fanconi's anemia there. So it was some pretty rare diseases. And that was just because of the hospital I was associated. So that kind of gives you a breakdown of the healthcare. It's pretty extensive. The only other thing only other thing I'll say about it is Cubans are integrated into their healthcare. How many people here haven't seen their doctor in 5 years or don't have a PCP or something like that? That's not the case. It's not the case in Cuba. Everybody will tell you about their consultorio doctor. They'll tell you about all the other consultorio doctors. They'll tell you who works at the urgent care center on Fridays. They know their local medicine. Very involved.
Great, thank you. And then, so the last question that we have, and then we'll open questions up to the audience. We have graduates of the Latin American School of Medicine here, and so it's the largest medical school in the world. In physicians who train there, they travel all over the world to different areas that need physicians. And I think they export more doctors than any other, Cuba exports more doctors than any other country in the world. So being that we have a bunch of medical students here, we're wondering if you guys could kind of speak on Cuban medical education and what is unique to Cuban medical education.
And if you want to give a breakdown just of like what ELAM is and differentiate, because there aren't Cuban students at ELAM, it's an international medical school. So maybe Abe can just kind of give a quick explanation of what that, what ELAM is, and then a little bit about internationalism for Cuba.
Hi everyone. So ELAM, Escuela Latinoamericana de Medicina, or Latin American School of Medicine. Briefly, it used to be a naval base, right? And when Fidel saw the need of sending more doctors into countries, especially recruiting students from the most marginalized communities all over the world, they were recruited to the school so they could be trained for 6 years and be sent back to their countries as physicians and establish a quality and proper accessible healthcare system in their country, in their communities. So ELAM being a naval base, it was an international school. Students this is where we did our basic clinical sciences, right? And we were based there for either 2 to 3 years, depending on our Spanish levels. And here we got the opportunity to really create families, not only amongst ourselves from the US, but from all over the world. My roommates, which were my first year, were about 12 in one room. There were Brazilians, there were a couple from Western Sahara that I feel embarrassed to say that I didn't know it was a country. I thought it was a desert in Africa. And I learned that Western Sahara is an occupied territory and that they live in refugee camps. And here I am, and he's one of my best friends right now. And we constantly interchange ideas, and we have this dream of creating a network of clinics and hospitals that provide the type of healthcare system that the Cubans do. I have another roommate from Colombia, from Chile, from Venezuela, and from Belize. So imagine all this mix. There's a mix of languages, religion, food, and I think for me that was one of the greatest experiences that's really invaluable. You can't put a price to this type of education. I don't know if you all know yet, but we are not charged for our education. Our education is that we are debt free. The reason for this is to allow us to go back to truly do the work that we are set out to do in our communities and not have the burden of having to graduate and pay off our loans, right? Something that I think differentiates the medical schools and school in general in Cuba and university, from my experience in the US, I don't know if you all had the same experience that I did, but I definitely did. And being from San Francisco, it was really surprising, especially at San Francisco State University, where you will walk into a classroom and the teacher would just start talking. I never knew who my classmates were. I didn't know who the person next to me was, where she was from, or what their name was even. And they create this sense of competition amongst each other. Here in a medical school, you're all going to be future physicians. And I hope you're all here because you're doing it for humanity. Your association organization is called Healthcare Revolution, right? Revolution to us means to change everything that must be changed. When you're going to get involved in a process of revolution, remember you have to do it. What's the most important aspect of a person to be a revolutionary? Do you all know what that is? It's love. You can't have revolution without love, and especially in your future careers. If you're not in this career because of love for humanity, I don't know what to tell you, but for sure, you know, so I like that name. That's why, because that word revolutionary, changing the things that must be changed. Our healthcare system needs to be changed. And it's going to take a long process, but I think we could all do it if we all have that mentality. And step away from the mentality of healthcare for profit. Stop seeing your patients as clients. I know you're in a medical school, and I don't know how your medical system works at your school or how your professors teach you. Step away from that mentality of having only 15 minutes per patient. If I don't see these patients, our hospital's not going to make money. Be human beings. You're dealing with human beings. Human beings want to be touched. Human beings want to sense love. You know, don't rely. These are your biggest tools. That's what we're taught in Cuba. Your hands are your most important tools. And we're all fortunate in here, I think, to have our hands, our fingers, our ears, our nose. So use that, okay? And that's one of the biggest differences that I saw, that a lot of times when my classmate was not doing so well in a classroom, and let's say I was doing well, sometimes it wasn't like that. And the professor would come up to me and say, how come your classmate, especially if they're from the same country, why are you letting him fail or her fail? You need to do something to help this person out, because you're in med school, we all study, but sometimes we study wrong, or sometimes our study method doesn't work, everybody learns differently, and some people are gonna perform better in some things than other things. So you're all here for the same purpose, you all have the same goal, which is to create a better humanity, to heal humanity. Why not help each other accomplish that? It'd be much more easier for everybody in your classroom if it works like that. So please, when you go to a classroom setting, eliminate that sense of competition. Interrupt your professor if you have to, and say, wait, I need to get to know my class first. I need to know who I'm working with, right? And it's gonna be much more better for everybody. So I think that's one of the differences that I noticed from my school and university here and university in Cuba.
Do you want to say anything? Greg, do you want to touch just for a second on internationalism? Since, you mentioned how Cuba sends people all over the world. Greg actually, right when he graduated, went to Haiti after the earthquake and worked with Cuban doctors in Haiti. And he was working in the area where cholera hit the hardest. I don't know if you all remember that or heard about that.
Well, I think one of the things that makes the Cuban medical education and their whole, the health system in general different, two basic things. One is that they see healthcare as a right and not as a privilege. It's not a business. They don't treat their patients like clients, and their diseases are not commodities. And the other thing is a sense of family, not just, even though our government has a foot on their neck, for the past 60 years, they still see us as their closest neighbor. And wherever is needed, even if they have shortages, they send out doctors, they send out resources. And it's not just selling what you have left over, it's sharing what you have. If I only got one piece of candy, I'm breaking up against, whoever's here in the smallest piece. And that's the whole reason why they started this medical school in the first place. They saw a need with their neighbors in the Caribbean who were devastated by hurricanes, and they sent doctors out there, on their limited resources, doctors to alleviate the hurricane effects. And they found out that it'd be better to take young people from those same medically underserved areas or those devastated areas and train them in Cuba, where they can go back to those same communities where they have a better cultural sensitivity, their own language. And even to, sons and daughters of Bush, who we were when we were coming into the program. I think it's pretty amazing, and we can learn a lot from them. When I went to Haiti right after I graduated, there was an earthquake in January 2010, and I came in around August after I graduated in July, and the Cubans had already been in Haiti at least a decade before the earthquake, and there was other countries coming in trying to give help, the UN, Norway, France, and whatnot. And the place where I was stationed in Lester, Artibonite, Haiti, was right on the river where the cholera outbreak started. And humbly speaking, we recent graduates, our group of doctors in that center, recent graduates, attained the lowest mortality rate for cholera. And we were stationed in tents, we didn't have ultrasound, we didn't have a lot of the laboratory reactants that were needed. But it's the attitude of not waiting for people to come to you, you outreach to them, and going to most of some places we had to, only accessible by boat or going up in a mountain. And that loving service, that reaching out, and I think that's the main reason why we attain better results than any other place. Fidel called the place we're at to congratulate us. He was very proud that we had made these efforts in healing the Haitian people, and he said, very grateful. Thank you so much. A lot of people would have died if you guys weren't there, and we're receiving our free education, and said, thank you for giving me the tools to be able to help in this capacity. And I can tell you a million stories of how, but it's like I said, it's about the center of this revolution is love. And the whole premise why we're here is because we want to see these old failed politics die. We want to end the blockade because it just doesn't make sense that our closest neighbor, who still love us like brothers and sisters, even though we treat them wrong, are still in our, I don't know if you guys were aware that during this last Hurricane Irma, and Cuba was quite hardly hit, really devastated, they still sent 750 doctors out to the Caribbean. Seeing the world as your family and healthcare, we're only a society is only as strong as its citizens, and if you have people that don't have access to healthcare, you treat them as clients, you're only going to have a sick, stupid society. And I think we really need to learn from the Cubans.
Hey guys, my name's Mercedes. I'm actually from Northern Virginia. I was raised here. I went to George Mason University. Definitely the difference in just the education system. I can say in all of my primary and secondary and university career, I could probably count the number of minority professors that I've had on one hand. And then in my first year of medical school, Cubans, they don't really differentiate themselves, like I'm lighter than you or all that, but just the amount of red, pink, blue, green Cubans of highly qualified and highly educated doctors that looked like me. They didn't sound like me yet, but or I didn't sound like them yet, but it was just amazing. And just mentorship was something that my university was really big, and I did get an amazing thing out of George Mason. The level of mentorship that I was able to attain with Cuban professors that extended way beyond the classroom. It was just, so robust in so many ways. I just can't even describe it. Finding physicians that were interested in the things that I was interested in and looked like me and didn't look like me but would still push me like if they were my mother. It was just it was amazing. One thing that I just want to expand on AB, not competing with one another, partly why we don't do that is because if that person fails next to you, that means there's one less doctor for the world. So that's the drive home purpose. If one of your classmates is not doing well because they're far from home, they're having family issues, they're not feeling well, they're in some other space, that means one less doctor for the world. And that's definitely, in our med school, that's what it means. It's one less doctor for that country, whether it's the US or, Mongolia, and that's the drive home purpose. So that's why we don't compete with each other that way. It's to bring someone up. And even as we did our USMLEs, it was just, everyone did their studying and we'd ask each other questions. How are you studying this? And we'd give just little mentorship groups if we needed it. And then it was like, okay, you got it done? I feel like we're excited. Another person crossed another board, and it was like, hooray. No one's praying for someone to slip and fall. So I don't think it's really like that with you guys. I hope not. I hope not. But yeah, just to kind of bring that back. And just lastly, just with our universal healthcare, it's just an amazing foundation that we have when your university's purpose and goal is the same as the culture that you're actually living in, and then the government's goal and purpose is all the same. This, unity of purpose in this country of Cuba is just kind of amazing. It's not those conflicting ideas. At school they're teaching us, okay, let's do one thing, and then outside you're fighting with your government. And just to be able to have that as a foundation of, okay, solidarity, healthcare for all, and all these things, it's just amazing to come back into the US and just kind of figure out where we stand and what differences we can make, how we join our American our American classmates or counterparts and see how we can just make your healthcare better. So that's my 2 cents.
All right, I just really had to share this. When you talked about USMLE exams, you all know what, or you will know what it's like, where you feel like you're by yourself. I recently finished taking my last board exam, and I had friends everywhere lighting up candles for me in Cuba, my Cuban family, and you could feel that energy. When you walk into an exam, you know you're not walking in by yourself. You have all the support, so do that for each other. It's really going to help you pass and do well.
I guess you can see it was okay. We thought it was all right there in Cuba. And I'm sorry we're taking so long, but it's hard to sometimes say things really concisely. People want to say so much. So I hope that's a reflection of how appreciative and how much we enjoyed and got out of it.
So before we open things up for questions, because I know some other people might have to leave, we just wanted to thank you guys for coming here and sharing all this from the bottom of our hearts. This is absolutely fantastic and invaluable. So thank you. And anybody have any questions?
First of all, yes, thank you so much for coming here and sharing your stories and experiences. Is there room for appeal with regards to healthcare and medication and all the different treatments you're referring to? Is there room to appeal on the international level to make sure that, or to get around the fact that this country is blockading against those items, or do other countries not care that we're doing this to you guys?
Can I say something? I think everybody wants to say something.
As far as the international community is concerned, every year there's a vote in the United Nations, and whether whether these countries are in agreement or not with the economic blockade of Cuba. Year after year, the numbers have been increasingly in favor of lifting the embargo. The last year was 191 to one country, Israel, which has abstained. The whole international community is against this. Even the polls in the United States show that the American public is, in agreement of lifting the blockade and this old failed policy that hurts both sides. What was the other part?
I guess I'm just saying specifically with regards to treatment and medication.
Well, so let me just say 2 things about that. We were in a briefing in Congresswoman Karen Bass and Barbara Lee were there, right? So this was just on Wednesday. And they had passed laws in the United States that would actually allow these drugs to get in, specifically about that. And so they were really shocked to hear the doctors realize that that's still a problem. So on the law, some of these things can legally go through, but how convoluted it is and how much paperwork and how it actually works out has basically made it not work, right? So that's kind of one problem. And then, Lynn wants to say something, but the only thing I'll say is that I think it is important to recognize some of the political structure in the world that we have today, unfortunately, really is dominated by just a few countries. So when 191 out of 193 countries in the United Nations vote for something, the reason that doesn't mean anything is because it's the Security Council that makes all the decisions. When the World Health Organization, decides its policies, it's made by the people who give the most money to it. It's made by the United States and these countries. So unfortunately, the lack of democracy in the world means that that's the biggest reason. Because the biggest pharmaceutical corporations in the world are the same ones that set and make policies in the World Health Organizations and things like that. And that's what prevents it, in the end, from really being able to get. If everybody were able to vote, this would have been ended a long time ago. But what did you want to say then?
Yeah, well, I was trying to think the whole questions that you are doing to the panel, and I think that they have been doing great. But I just want to add one thing. Next November the 1st, United Nations is going to vote again the resolution that Cuba presents against the blockade. Last year, these 2 only countries, Israel and the United States, abstained. But from last year to this one, you have had a lot of changes in your country. And we don't know yet what that will be this year. Unfortunately, what David was saying is completely true. 192 countries voting against that, and nothing else happened. That is a bad sign that we are not doing it well in this world. And I wanted to give you a clear example, because you were mentioning international approach. The World Health Organization, that it is the one who guide the policies on health care and all over the world, work together with Cuba to go to Africa and face the situation with the Ebola diseases. Probably you know that more than 100 Cuban physicians went to Africa to help in this situation. Well, the World Health Organization couldn't pay the stipend to those doctors due to the policies of the blockade. Why? Because they were paying in US dollars. You were mentioning about some policies that Obama is, but I have to say that most of them only on speech. Because the truth is that Cuba cannot make financial transactions in US dollars. So how come, he announced that in March when he visited, in 2015 when he visited Cuba, he announced that Cuba will be able to use the US dollar. So far, Cuba hasn't been able to do that. So how come the doctors or the healthcare institutions in Cuba are going to buy new medications or new equipment if you cannot do it in dollars? And in other sectors, not specifically from health, but it is related, because in health you don't not only need medications, but you need food, you need materials to reconstruct hospitals. Cuba has to pay for those services in cash, in advance. Nobody in this world trade in that way, so it is crazy. And that's why we feel proud about all these people, because they are demonstrating that the blockade policy is a failure, has failed. Because Cuba keep their love for others and for ourselves. So it is very complicated to talk about the blockade, because one thing it is what the speeches, what the media is saying, what the many visitors from the United States are talking about, how fun they had in Cuba, but deep in the economical situation and deep in the bilateral relationship, not much has happened. And an example of that is that even though Obama signed executive orders to ease some parts of the blockade, the truth is that the US Congress hasn't done much about that, because the blockade is only a word, but it is a set of laws that has been approved since 1962, even before there were attempts of, there were some regulations on trading with Cuba, but in 1962 it was the first law approved calling for a blockade on Cuba. And the same objective of that time, it is the same objective as now. And it is to make people of Cuba suffer. Because the more people in Cuba suffer, the more they will, or that was the US expectation. I mean that the Cuban people will rise up against the system, against the government, and that's why, again, it is a failure, because more than 50 years have passed and people in Cuba maintain their society as constructing and building a socialist country with, in health, all the things that they have explained. Thank you.
And you just mentioned too that we've been going around to a lot of Congress people and senators. The majority of people in the United States don't agree with the blockade, and that the polls have shown that. And my vibe is I don't even think the majority of the Congress people agree with it. You have a few people that are still holding on to it, but the issue for us and what we're trying to do is how do you create a priority for those Congress people, right? So they don't necessarily agree with it, but are they going to get up? They're worrying about DACA now. They're worrying about other health care. They're worrying about things that their constituents feel like and they're thinking about. And unfortunately, this hasn't been on their mind about Cuba. How much have you all heard about any of these issues that we're talking about today? Probably not a lot. When I go around the world and I say I study medicine in Cuba, and I talk to people all over the world, everybody says, oh wow, Cuba, we have Cuban doctors in our country. That's amazing. That's great, but right on it. You know what happens to me consistently in the United States, it doesn't happen anywhere else? Cuba. Well, why'd you go to Cuba? That's interesting. And that can only be asked by a group of people who don't know, that they really don't know. And that's another thing about the embargo that's bad, is it has kept the American people in the dark. And we're literally, in this age of information, way less informed than the rest of the world about something that's pretty important, I would argue. And so that's, and I'm gonna say the internationalcommittee.org again. And so people can like learn about the efforts going on in this country to end the blockade, because we have to help make it a priority for the, let the Congress people know that it's important to us. So we're still in questions?
Yeah, and anybody, who else has?
I just kind of had a devil's advocate question. So
Okay.
sometimes when I go to these kind of panels and then I leave and I try and argue the points made, and then the same kind of questions are brought up, and I'm like, oh, I should ask from their perspective the question. So only for that reason am I bringing this up. What do you think some of the drawbacks are to Cuban political policy and or healthcare policy?
Does anybody in particular want to answer that?
I can say something as a primary care practitioner in this country for 25 years. It's like the way healthcare is supposed to work here is like an assembly line. You know, and everybody's going to this whole video thing. You're supposed to see patients like this and make money for your institution. And the Cuban healthcare center system is exactly the opposite of that. It's like you cannot see people with heart and care about folks on an assembly line. And that's one of the contradictions that we have. And you all are going to be trained in assembly line medicine. And how you figure out to fight back against that is going to be part of how we're going to change the healthcare system in this country.
I think your question specifically are drawbacks you see to the Cuban system, though. Is that what you were saying?
Yeah, just like if for instance, yeah, exactly. That's exactly.
Sorry.
I mean,
Yeah.
that, you know, so, I mean, Layman was the first person to say this all the time. You know, Cuba isn't going around saying we're perfect. That has nothing to do with anything. It's just that we have value and we deserve to be sovereign. So I don't want you to go away and go, oh, did you hear this perfect system has been invented in Cuba? That's not what any of us are saying. You know, I think Cubans, you know, there's lots of examples. I don't know if anybody like wants to give it here, but there's difficulties. So the difficulties aren't always external; they're internal, they're cultural. You know, I think Cubans deal a lot better with a lot of dynamics between race and things like that in their country than we do. But it's not perfect. You know, there's still things like that going on there. So I mean, it's a complex question. I don't know if people want to address it specifically.
Maybe Lema wants to talk on that.
Yeah, I think she'd be good at it.
He's just saying that, you know, people are going to come and ask him questions, and it's not all going to be positive. So what are examples of things at Cuba where they need to improve, or things that not be good, things like that. And so she's going, well, yeah, a lot of hell, you know.
We have a lot of things to improve. And every time someone asks you what Cuba is trying to change, I highly recommend that they read the information about the update of the economic model and social programs in Cuba. There you will find more than 300 objectives that Cuba is trying to achieve, improve, change, update, upgrade, and all the words that you can use on that. In 2009, 2010, 2011, in Cuba we started to have debates in hospitals, polyclinics, schools, neighborhoods, other institutions, social organizations, community projects, the media. Everybody was debating the draft that was presented by the government, and the ideas of more than 8 million opinions out of 11 million. So children and elderly with some kind of disability couldn't participate, but the others were part of this national discussion. And out of that, the Cubans changed more than 60% of the draft that was presented. Cubans gave more opinions about that instrument or document. So then, since that moment on, we have been implementing the part of those goals that we want. One of those, it is in the healthcare sector, repairing the hospital, increasing the salaries of doctors, nurses, and personnel of that ministry. So that is something that healthcare institutions needed. But you can see it in the factories, you can see it in educational system. You can see it in agriculture, that part of the transformation of the economy that we are having. So Cuba recognizes, nationally speaking, what are those things that we have to improve? What are our failures? What are our mistakes? So Cuba is very aware of what we have to change. Well, where is the problem? It is not only culturally that Cubans don't like others to come and tell us what to do. That is part of the culture. But the other thing is that we have the right to decide what to do in our country. And part of that right, it is what I was mentioning. What we do not want, not the people that are part of the government, not the institutions. No one wants a foreign country to come to our island and tell us, you have to have the same healthcare system that we have in the United States. Why? That is not fair. That is not fair. I said this because I've been learning a lot about your system, and I said that it's not fair for the Cubans to have yours. But it is not fair, even though why we have to accept that? What it should be happening, it is that the good things that you have, technology, research, specific medications, can be